focus on Bell's palsy in this lecture. And in Bell's palsy, we have inflammation of the facial nerve or cranial nerve number 7. And typically this affects one side of the face. Now, the exact cause of Bell's palsy is unknown. However, you may see herpes simplex virus on your Nclex exam. Typically, that is what Bell's palsy is attributed to. Again, HSV or herpes simplex virus may cause an inflammation and demyelination of the cranial nerve number 7 or the facial nerve. Make sure you know that for the Nclex exam. Now, we talked about how demyelination will have certain effects when we talked about multiple sclerosis. And because of this demyelination, there may be some motor and sensory dysfunction in the face. All that really boils down to, all that really means is patient may suffer from facial drooping or difficulty with facial muscles, difficulty with smiling. And we're going to focus on that on our clinical manifestations. But again, make sure that you know that this is really due to infection with herpes simplex virus 1. So let's move on to our clinical manifestations. Number 1, patients may complain of pain around the ear, and upon visual inspection you may find some vesicles or herpes around the ear. So that's number 1. That is very specific to Bell's palsy. Again, this is induced or brought on by a herpes infection. So if you see that on the Nclex exam, make sure you know it's talking about Bell's palsy, especially if it also talks about number 2, facial drooping. Again, the facial nerve is what is being affected. Therefore, there will be facial drooping again on one side of the face. Now, because the patient is suffering from facial drooping, sometimes when the patient comes in through the ER, physicians and maybe the patient as well may think that they're suffering from a stroke. Because again, there's facial drooping. They are unable to close their eyes completely. They are unable to smile or frown, difficulty whistling, and difficulty chewing. So again, all of these signs and symptoms may mimic a stroke. Now, there are no diagnostic studies to rule out Bell's palsy, but again, patient will come in through the ER most likely, have some facial drooping. They'll be concerned with possibly suffering a stroke. So what is ruled out is a stroke. So typically patients will get a CT scan of the head and make sure that they aren't suffering from something like a stroke. But again, there are no specific tests to rule out Bell's palsy. Now, what are some interventions that you need to know for the Nclex exam? Number 1, begin corticosteroid therapy immediately. Most likely something like prednisone will be prescribed. Now again, make sure you know all the complications regarding corticosteroid therapy use. For the Nclex exam, it's going to cause hyperglycemia, weight gain. Again, you will tell your patient to never abruptly stop taking the corticosteroids. In fact, most likely they will taper off of these medications over a 2-week period. Number 2, we talked about how this may be due to a herpes infection. So something like acyclovir and an antiviral medication will be given. Number 3, you can provide hot and wet packs. This will be to reduce pain, for pain relief, and to also increase circulation. Number 4, you want to you want to educate your patient on protecting the face from cold temperatures. Number 5, you want to tell your patient to chew on the affected side. Again, part of the face will be affected and they will have difficulty chewing. So you want to tell that patient to chew on the unaffected side. Number 6, you may provide artificial tears. Now, some patients may actually have large amounts of tear productions, and some patients may not have enough tear production. And now I mentioned that patients may not be able to completely close their eyelids. So again, you would want to give artificial tears, prevent eye dryness, something like methylcellulose. So again, if you see that on the Nclex exam, make sure it's talking about artificial tears. Again, we want to protect the eyes from becoming dry. Also, we want to protect the cornea from corneal abrasion. Again, if they have difficulty closing their eyes. This is very important when they go to sleep. So you may also educate your patient on taping the eyelids closed at night. Again, we want to protect that eye. And number 7, something also that can be done is electrical stimulation of the facial nerve of the face. Again, this is done to maintain muscle tone.